A very warm welcome to all of you on another episode of In a Swank Way. Today, on the occasion of International Women's Day, we are going to discuss about how men can support their partners. Today's topic is Decoding Women's Health, a guide to men. So let's have a heartfelt conversation filled with myth-busting insights and a celebration of shared well-being. Let's begin. So, on the journey of holistic wellness, let's first begin with Behind the Radiance, a dermatologist perspective. Today, we have Dr. Vrushali Rane with us with more than 12 years of experience in her field. So, thanks for coming, Dr. Vrushali.
Thank you for having me.
Yeah, and I would like to know more about your journey and your experience.
So, I am a dermatologist. While a lot of people may feel that a dermatologist is just a skin specialist,
Acha.
that's not entirely true. We are doctors of skin, hair, and nails.
Okay.
So, I'm a doctor of all of this. And apart from that, my forte is aesthetic dermatology or the beauty dermatology.
Okay. So how different it is than conventional dermatologist practice?
So conventional dermatology teaches us more about dealing with the disease aspects of skin, hair and nails. Whereas aesthetic dermatology, the one that I follow, or the one which is my forte, deals more with the health, beauty and wellness aspects of your skin, hair and nails. I also do treat the disease aspects, but my forte is the wellness aspect.
Okay. So when we talk about health, beauty and wellness, majorly women are interested, right? तो मुझे जानना है कि दोनों जो genders है, men and women, उनका perspective क्या है and what are the different type of issues they face?
So I'll answer this question one by one. Let me start with the issues first. Okay. Now, जो अंतर बनाया हुआ है between men and women is actually majorly generated by the media. Okay. As a dermatologist, जब मैं आपको treat करती हूँ, for me it is the type of skin, right, or the type of hair, or the type, or the depth, the thickness. You know, all these things come into perspective. The gender really doesn't play a role, but the media has made a huge difference in it. अब जैसे let's talk about the common issues that people have. Okay, acne. Everybody goes through acne at some or the other point of time in their lives. Now both men and women get acne. लेकिन अगर हम severity की बात करें तो men, there is more likely a chance that men will get more severe acne. Okay. या अगर हम acne scars की बात करें, severity of acne scars के हिसाब से men tend to scar more as compared to women. Okay. या अगर हम pigmentation की बात करें, because women are more conscious about how they look, they are very particular about using preventative products like wearing a sunscreen as opposed to men. Right. So pigmentation भी ज़्यादातर men में long term होता है या जिसको treat करना थोड़ा difficult हो जाता है. Right. But melasma एक ऐसा pigmentation है जो purely hormonal है. So it is more common in women. It also happens in men though, but it is more common in women. Aging एक और चीज़ है. Aging because your face is bulkier, your muscles are bulkier. The lines that are formed are much more deeper in men. Right. Whereas in women, it is not as much deeper. But overall, it is more related to the thickness of skin, the skincare they follow, and not so much as the media hypes about it. Okay.
So just now you mentioned about ये media ने जो hype किया है about बोलते हैं ना men and women, gender में, about skincare as well. So what are the myths that you want to burst today?
So if you today look at a face wash that a man has to buy, you will see that they'll show men running around, pollution, black color ka branding, charcoal face wash. Right. Not all men need that. Right. You know, like men can also have dry skin. If a dry skin man uses a charcoal based face wash, it is going to make his skin more dry.
Right.
So that is one of the most important things. Ki men's skin is supposed to be all tough and rugged and oily and greasy, so they'll need charcoal based face wash, but that's not the truth. Okay, that's one of the biggest myths that I feel that is there.
Okay.
Secondly, moisturizer for men and moisturizer for women. There is no such need for such things. You can have the same kind of moisturizer for both men and women depending on the types of skin.
Right.
जैसे एक ऑयली ग्रीजी स्किन है, उसके लिए आप एक जेल बेस्ड मॉइस्चराइजर लगाइए, इट्स मच बेटर. If it is a dry skin, use a cream based moisturizer.
Right.
If you're using it for the body part, use a lotion based moisturizer. So you don't need to have a men women's thing in that.
Right.
I'll tell you one more very common example. Minoxidil is a lotion which is given for hair loss.
Right.
Okay. Now, if you go to like a place where they sell all these products, a minoxidil, same percentage for women will be charged more than men.
Okay.
Because they know that the audience, the consumer for women's hair loss is much higher than a men's hair loss.
Right.
The product is the same, the percentage of minoxidil is the same, but the costing is very different. I think this is something that personally I am not very comfortable with from a consumer point of view as well as from a doctor's point of view.
Right. And thanks for highlighting that, because personally I will tell my example. So my wife and myself, we both have dry skin. So we are not using two men and women ka different
Exactly,
products. We are using the
exactly.
same product.
Yeah.
It saves money. I mean,
It's economical,
Yeah,
and
cost
it creates a kind of bonding also. When I'm
Right.
applying my moisturizer, I'm asking you, did you apply yours?
right.
So,
And it is very easy for me to not to research which type of or
Yes.
which category of moisturizers are suitable for me.
Yes, yes.
Yeah. So when we talk about this collaboration or maybe working together towards skincare routine, so what is the collaborative skincare routine that you would suggest for both the genders?
Okay, so you're talking about a spouse, I believe, like a
Yes,
spouse or
partners
sibling,
or staying
partners, or
together.
yeah, okay. So collaborative थोड़ा मुश्किल होता है, but हम उसे आसान कर सकते हैं.
Okay.
Like for example, when we talk about skincare routines, there are non-negotiables and there are negotiables. Non-negotiables मतलब जो हम सब इस्तेमाल करते हैं. It doesn't depend on our gender or our skin type or anything. So there are 3 non-negotiables that everyone has to use. There is a cleanser or a face wash, there is a moisturizer, and there is a sunscreen.
Okay.
So as a couple, of any kind, could be siblings, could be partners, spouses, parents, anyone, ये 3 चीज़ें आपके कबर्ड में, आपके वॉशरूम में या आपके wherever you store your skincare, ये 3 चीज़ें होनी चाहिए, and this is the place where when you wash your face, you can remind your partner. When you wear your sunscreen, you can remind your
Right.
partner that did you wear your sunscreen, did you carry your sunscreen bottle along with you so you could reapply it. As far as the negotiables are concerned, those are your active skincare products. Like for example, if I have acne, I'll have an acne care cream.
Okay.
If I have pigmentation, I'll be having a pigmentation cream. But if we are the same age and we're using an anti-aging product, we can share that cream.
Right.
So that's where the collaboration can happen, because all these products don't come cheap.
Right.
But if we are both in the journey together, it's something similar to weight loss, right? If I'm trying to lose weight and if my spouse helps me, it generally becomes a more fun journey.
Right.
So the same applies to skincare as well.
Right. And just now you're talking about anti-aging, right? So generally people think that after 35 or 40s they should start doing it. But one of the counselors, that person told me that you should start in early 30s. I don't know, like how right it is.
So you'll be, it's a funny saying that you start aging the day you are born.
Right.
Because
It's a
that's
fact.
Yeah, it's a fact. You lose a certain percent of collagen every year of your life. So obviously you're aging. What I feel is in your early 20s, or I think probably in your teenage for that matter, start wearing your sunscreen.
Right.
That ways you can delay aging much to many years, and you can start on a good anti-aging routine in your early 30s.
Okay.
See, any anti-aging routine that you follow is going to take care of the superficial part of your skin. For the deeper part of your skin, the sagging that happens or the looseness of skin that happens, you need procedures. But at least the fine lines, the wrinkles can be pretty well managed by wearing a sunscreen in the day that prevents further aging, and using a regenerating cream or an anti-aging cream in the night that reverses the aging that has already happened. We got to do both the things. Just one thing wouldn't make a difference.
Can you recommend any products for both the cases?
So, sunscreen there are a lot of sunscreens that are out there in the market, and when people ask me which is the best sunscreen is the one that you are using daily.
Okay.
Okay, in India there is no authority which tells you which grades sunscreens. So you really can't say that this is a better sunscreen than this one. But personally, I prefer that if it's a medicated brand, it's better.
So coming back to our topic, how men can be supportive or better at understanding women's health in terms of skincare.
Well, you know, Tushar, times have changed, and I have genuinely seen men being very supportive about their women, whether it is their skincare journey or their life journey in general. But there are some specific points I want to highlight over here. Number one is when your spouse or partner is visiting a dermatologist or your sibling is visiting a dermatologist, being a part of the consultation helps a lot in understanding the obstacles in the journey, the side effects, the downtime, how
Right.
to plan ahead based on these things. Okay, so being a part of consultations is very important. Also, men can give in a lot of inputs. I have heard some really smart questions coming from men
Okay.
while offering a consultation to a woman, and very practical and very intelligent questions. So I love it when partners come for skincare consultations of women. Secondly, two very crucial times in a woman's life. One is around the pregnancy and one is around the menopause.
Right.
So during a pregnancy, a woman post-pregnancy, post-delivery generally, when there are a lot of emotional, hormonal upheavals that are undergoing in a woman's body and mind,
Right.
there's something called as hair loss, where you actually lose tons of hair. And it can be extremely, extremely demoralizing for the woman. A hair is a woman's crowning glory.
Right.
And that time, just that thing that it's a reversible condition. So just having a supportive partner will help a lot. Ensuring she takes her medicines on time, because the mother is so preoccupied with the baby. Making sure that you took your medicines on time, you applied your hair lotions on time, itself is a huge booster and brings
Right.
down your stress a lot. There is also another condition which happens during pregnancy and also near menopause, which is called as melasma.
Okay.
It's a butterfly-like pigmentation which comes on people's faces, and it's very hard to treat. Even from a dermatologist's point of view, it's very hard to treat. And I've seen women running around places trying to get it treated, from neighboring auntie to beauty parlor to some magic miracle product they see
Right.
on Instagram to a dermatologist office. And if you would have a man who would be like, let's go to a dermatologist and understand what is happening and what really can we do about it, I think the woman will also not be so hassled by the pigmentation that she's having.
Right.
So these are a couple of things where I think being a part of the journey, to put it very simply, being a part of the journey, whether it is going to a skin specialist, being there during the procedure, being there as a part of the aftercare, these would be simple ways, very simple ways men can participate in a woman's skincare journey.
Yeah. It's just being there and
Just being there, yeah.
So now let's also talk about hair loss. I think on Instagram we see thousands of reels कि ये apply करो, वो apply करो, आपके बाल इतने दिन में आ जाएंगे, ये products use करो. So just tell me broadly, like how we can treat it, or is there any way to treat it?
Okay, so before we go about treating a condition, we have to diagnose it.
Right.
That is the core why medicine is different from anything else, right? When you talk about hair loss, as a dermatologist, I first need to identify what is the reason for your hair loss.
Right.
Okay, it could be a nutritional reason, it could be a hormonal reason, it could be a stress related reason, it could be related to the medicines that you are eating, it could be related to some temporary things like you had typhoid a couple of months back, you did a couple of hair procedures like straightening or ironing or rebonding or perming, or it could be post pregnancy. So there are a lot of things. So first is we have to identify the cause. Now I'll tell you this very funny thing. 90% of our hair health is identified by what we eat,
Okay.
how our body responds to stress, and what is our hormonal balance.
Okay.
10% of our hair health is identified by what we apply. Unfortunately, we invest 90% of our energies on what we apply. कौन सा तेल लगाऊं? क्या मैं उसमें कड़ी पत्ता डालूं? क्या मैं अनियन शैम्पू यूज़ करूं? या मैं स्पा कराऊं? Or I do some, so everything on application, and I don't think we even focus 10% of our energies
Right.
on our nutrition or our hormones or how our body responds to stress. So this is a huge myth. And what happens is our nation is a oil loving nation.
Right.
We are obsessed with our oils. In fact, we are the biggest consumers of oils, hair oils. But you would be surprised to know that oils only condition your hair. They do nothing. जड़ों से जाकर अंदर से मजबूत करना doesn't happen. It only looks good in that animated video that you see. It doesn't happen like that. In fact, in a lot of people, application of oil can trigger infections, fungal infections, can make your dandruff worsen. So when it comes to hair loss, first thing is just try to figure out what did I do wrong. Did I lose a lot of weight by crash dieting, so all my nutrition was taken away? Or did I have some stress a couple of months back? Or did I do some hair procedures? If you can't figure any of these out, visit a dermatologist. There's a good chance a diagnosis will be established, a treatment is started. Also, when it comes to hair loss, give it at least 3 months of time. Your hair is not going to, you pop a pill, your hair is not going to stop falling. It's going to take at least 2.5, 3 months for your hair loss to actually respond, provided your diagnosis is right. So the first step is diagnosis. The second step is treatment, which is generally internal and very less external. And the third is relax. Stress is the biggest reason you have hair loss. You can have everything perfect. You could have the perfect diet, perfect hormones, but if you're constantly stressed, your hair loss won't stop.
Thanks for the tips and the myth busting part of it. And I think in this segment, one thing I want to take away from you, or maybe hamara jo conversation hua, is just be there with women.
Absolutely.
Right? Thank you so much. So now from outer beauty, let's talk about strength within, a physiotherapist perspective for women's health. And today we have Dr. Mitsudoshi with us. She has more than 15 years of experience, and I would like to know more about you.
Hello all, so I am Dr. Mitsudoshi, physiotherapist by profession, and I have done my masters in post-graduation in cardiothoracic rehab and metabolic rehab as well from UK. We deal a lot of cases in related to women's health as well as the general population towards heart issues, talking about uncontrolled diabetes, blood pressure, thyroid, lot of metabolic cases which we see in the daily routine via a new concept we call as physio rehab for the same. And I was also awarded as the best cardiac rehab specialist by Indian Healthcare Awards, which was conducted in Mumbai. Yes.
Thanks for coming. And the first question for you from my side is like, why physiotherapy is an integral part of women's health?
Well, women's generally have a lot of hectic schedules in our life, okay? So, talking about women health, we see a lot of women who are just a housewife, and we see a lot of women who are a professional woman as well, okay? So, they are taking care of the house, they are taking care of the professional stress, what is coming in their daily routine as well. So, woman goes through a lot of changes throughout her as her age increases. So, say when a woman is pregnant, or maybe a woman starts with her menses, okay, there are a lot of hormonal changes which goes ups and down till the time she reaches to her menopause. So there are these hormonal changes also gets lot of effects on her bone health, her muscle health. So when generally these women are coming to us and approaching us, they always have a thing that, okay, I have an active lifestyle. I go to drop my kid to school. I go for a walk. I do a lot of other things. I am doing a lot of stair climbing up and down. But still, there is no improvement or no benefit which I see in my body. Okay. So physiotherapy progresses out to diagnosis that why this is not happening in a woman's health. Make them a proper understanding that what kind of exercises will suit your body.
Right.
Sometimes even if you walk like 2 hours, 3 hours in a garden and you say, I don't see any benefit. So in a woman's health, what exercise to be done at what time, for what duration, how much it has to be go, that makes more important rather than just doing a physical activity. So women needs to educate well that doing a physical activity and an exercise, there is a lot of difference between them. Physical exercise is just going to keep you a little like healthy to perform your activities, but your inner benefits to your bones, your muscles, your organs is going to only come with exercises. So physiotherapy exercises are must for a woman's health.
सो इन डे टू डे लाइव्स हम लोग देखते हैं कि लॉट ऑफ वुमेन कंप्लेनिंग अबाउट नी एंड बैक पेन इश्यूज, राइट? जो भी टाइप का काम कर रहे हैं वो लोग घर पे भी करते हैं, ऑफिस में भी करते हैं. एंड द सेकेंड पार्ट इज अवर लॉट ऑफ टाइम दे आर कंप्लेनिंग अबाउट देयर वेट विच इज स्टक फॉर लॉन्गर टाइम. तो व्हाट इज योर ओपिनियन अबाउट इट?
Very nice question. So, as I said before, also, there is a hormone thing which plays in a woman. Okay, in a woman's body, we something called as queen of hormone. Okay, queen of hormone is called estrogen. Okay, nowadays women knows about it, most of them. So estrogen hormone is a very queen hormone which is controlling your body in the woman for a longer time, related to bone health, related to muscle health, related to even heart. You know, if you see the bone issues like knee pain, knee replacement, back pain, hip replacement, fractures, they are more commonly seen in the woman because the estrogen hormone which is present in the woman is controlling your bone health, your muscle health. So as age goes increasing, the
Right.
estrogen level in the woman is coming down.
Achha.
And post menopause, the estrogen hormone, like whenever you get your menopause, okay, so estrogen hormone is getting depleted. So estrogen hormone control करता है तुम्हारा bone mass. Okay, अगर वो hormone कम होता है तो other factors will also lead to the depletion of it. If you see even the heart attacks are seen more in men. Okay, but estrogen is controlling the woman's heart very nicely. That is also one part of it. So that's why if you see the heart attacks are more seen in the men as compared to a woman. Coming to the knee pain and the back pain is more commonly also seen in a woman because her core muscles are not strong.
Right.
Okay, there is a lot of women who do exercises, they do yoga, they concentrate on stretching and strengthening, but somewhere they have to come across as a core strengthening. Now if you see in the daily routine life, there are a lot of exercises like Pilates which have come, plyometrics which has come. All these new form of exercises, if you see, their concentration is more towards the core strengthening. If your core is strengthened, the chances of getting a back pain or knee pain, because today's life, you cannot tell someone, okay, you please have a bed rest for 1 month, you have a bed rest for 2
Not
months.
even for 3 days.
Exactly. So if your core is stronger, whatever activities you're doing in your daily routine, it tends to take that weight properly and helps you for further benefits. So I would also recommend the woman that you should do a lot of core strengthening exercises, which can definitely lead to a lot of benefits to it.
Right.
Also, in physiotherapy, we have a difference of plyometric exercises and general strength training. General strength training we do with weights, therabands, tubes and all that. Plyometrics is something which we do for bone strengthening.
Okay.
So a woman should also learn these different types of plyometric and the weight strengthening. Divide your exercises in a similar manner. All the physiotherapy centers these days have these plyometrics training, Pilates training, which they should learn and adapt it. Coming to the weight issue. Now weight, if you see stuck, of course there is sedentary lifestyle, not doing anything,
Right.
that also gives weight. But in women there are issues like thyroid, PCOD. These women go through PCOD. Even if you see the young girls these days are stuck up with weight, they would tell you that I go to gym, I work out so much, I do exercises for a longer period of time, but I don't see any result.
Right.
When I joined the gym for 2-3 months, I saw weight loss. After that, I'm joining the gym, I'm stuck. Or maybe they will say that I joined the gym, but as soon as I left the gym, I'm stuck with my weight. Why? Because there in our body, there are 2 types of fats which are there, is acute and chronic. Okay. So acute exercise and chronic exercise. The acute type of exercises works only on the subacute fat, the superficial layer of the fat. The deep fat is burned only when you do chronic set of exercises, you continuous set of exercises. Now, we calculate everybody's calorie burning zone, which we call as new terminology as heart rate reserve. Okay, it is individualized for every person individually. So, say a girl having a PCOD at 23-year-old example, we calculate her calorie burning zone via heart rate reserve. If her heart rate reserve, your pulse, comes to say around her calories at 140 or 150 beats per minute, while doing exercises, she has to reach to that level.
Right.
If she gets exhausted at say 100 or 110 beats per minute in her exercise, where she is not able to go further, So she is doing a physical activity a little more advanced, but she's not come to her exercise zone where the plateau phase starts, where the results does not start seen, and hence you find that my weight is stuck over here. Okay, so these concepts which are new has to be explained to them, this has to be learned to them, they has to be guided that when are you exercising, so and so exercise will give you a benefit with so and so heart rate reserve.
Right.
So reaching your calorie burning zone is very important to know that like to get the benefits basically, and you will definitely find that your weight is not stuck over there.
Oh.
So this concept, if explained well, yes, it do give benefits. Exercise is something which just does not keep your body strong. It is also a base to your intellectual things as well to perform your other activities.
Right. I mean, really interesting, and I'm feeling so bad for myself. Yesterday only I was having a conversation with one of my young, I mean, she's hardly at 20, 21,
Yeah.
and she hits gym every day, right? And I was telling her कि ना कितने time से तो जा रही है, कुछ फर्क तो नहीं पड़ रहा है, but it
Yes.
is a bigger mechanism
Yes.
inside.
I think the principle which we call as FITT principle, FITT, which we talk of frequency, intensity, time and type of exercises. It should be like a doctor's exercise prescription.
Right.
At physio clinics, we give a FITT principle where how much frequency you should be doing, how much intensity is also important, what kind of exercise will suit to your patient. Sometimes say if there is a knee pain or if there is a hip pain and I keep on giving them a lot of strengthening exercise, I'm going to make the patient more vulnerable.
Right.
So guiding like a proper prescribing for them is definitely a good way.
Right.
And what I see in physiotherapy is we are taught with a lot of fitness assessment tests which are related to bones and muscles, which can be done after you diagnose any issues with it. So before giving the physiotherapy treatment, a fitness assessment is must to give you a proper prescription of exercises.
Right. And coming back to our topic for today, so how men can support in such situations?
Definitely. So I always see when what happens is when you're doing an exercises, always a support is
Right.
must. Okay. So we encourage a lot of partner workouts. We encourage a lot of sports where a woman and a man can play together. There's a badminton or there's any squash ball or any swimming. So all these things can be cooperated together as a couple goals. Also, we divide our sessions for men and women together where we concentrate on high impact and low impact activities. Okay, so endurance activities are more done by women comparatively, but men can do it better because they have a larger force of muscles.
Right.
Okay, so we do a couple exercise programs where there is a mix of low impact and high impact activities which can work as a partner workout. So those activities can be done and join a class or something like that. Motivating each other and working out is the key to exercise when you're working
Right.
together. We enroll them for a lot of competitive sports like a swimming or a badminton where they are playing opposite to each other.
Okay.
Okay, so that kind of competitive sports is also beneficial for men and women to understand. Equally to men, equally to even women and a men, both need exercise. It's not that only a man has to concentrate on the woman
Right.
for doing exercises. If they both motivate each other to do a proper workout, that would be definitely a great workout which can help. We do a lot of couple games, outdoor games as well, which are in a form of a strength conditioning.
Okay.
So these such games of couple games also help to do a couple workout together.
Right.
They sound to be like a games, but they are definitely like a strength workout. So all these things we definitely plan out at the clinic for the couples to work together, and in that way they both can have a good benefit together.
Yeah, and I think in today's life they can actually give time to each other in this sense.
Very true,
Right.
very true. Exercise is the one where they definitely can give time to each other while doing workout.
And now one more interesting question or maybe thought I had regarding the pelvic health. Right? I want you to enlighten us more about this pelvic health issues.
Today there are a lot of women who do talk about pelvic health. There was an era when women were very shy to talk about their issues related to pelvic health, but now women are pretty open to talk about it. There's a myth which generally a woman has is that the pelvic floor muscles which we have at the lower, which is an important part of your core in the woman's muscles. So pelvic floor muscles get weakened only if you have delivered a baby. Okay, so that's a myth. The pelvic floor muscles in the woman can get weak due to multiple reasons also, and they have to understand that strengthening the pelvic floor muscle is a process for the whole year of the lifetime they are living alive.
Right.
So that's a myth which everybody should get clear, that it's not only the pregnant woman after delivering the baby will have a weak pelvic floor muscles. There are a lot of programs which emphasize on pelvic floor muscle physiotherapy strengthening exercises. One of the commonest one, which is called as a Kegels exercise, where they can definitely watch over and learn about it. It's about just doing the contractions of your pelvic floor muscles while you pass a urine in the washroom. And because the pelvic floor muscles are inside your pelvic girdle, so there is something where you can do it from outside. The contractions a person has to feel and do those contractive exercises.
Right.
So Kegels exercise is the one which women should practice in their daily routine as to strengthen their pelvic floor muscles. Along with pelvic floor muscles, as I emphasized before, is the strengthening of the core muscles as well, because women's having a weak core muscle can lead to a back pain and can also affect the pelvic floor muscles.
Right.
So that's the main emphasis on pelvic health. As a physiotherapy point of view is we concentrate on pelvic floor muscle exercises.
Yes. So the kind of exercises that you were talking about are really fascinating. I mean, we can actually look forward to, and surely, I mean, that will help us understanding better and giving time to our partner, which I think is really important and everyone is craving for it.
Yeah, men can definitely understand the pelvic health and also encourage a woman to perform these activities for surely.
Thank you. So now let's turn our focus into our next segment. Here we are going to talk about the heartbeat of our societies and families, women's reproductive health. And today we have Dr. Tushna Kanga Menon with us. She has more than 12 years of experience, and I would like to know more about your field.
Thank you, Tushar. Thank you for having us on this podcast. So yes, I'm an obstetrician and gynecologist. I consult at CAR, at Worli, at Wadala. So I basically deal with women's health in all age groups, from a young girl till the time she becomes a grandmother, related to fertility issues, menstrual health, cosmetic gynecology, a very upcoming field, cancers, cancer screening, and endoscopic surgeries for the same.
Right.
So yeah.
And now today's topic is about how men should support, right, women.
Right.
So tell me how men can support a woman in terms of reproductive health.
So men's support, very frankly, for women's reproductive health is extremely crucial. Okay, and it's not something that starts or is taught at a later age, but it should something that should start at a very young age.
Okay.
So let me just turn this around a little bit and ask you, when did you start supporting women's health, or when did you learn about it?
I don't know, like I can share my personal experience. You tell me how relevant it is. So, okay, it starts from my school time.
Okay.
So I was not actually aware of this kind of issues in
True.
detail, right?
True.
So it was considered as, I mean, periods.
A taboo.
Right? And that time my mom used to not touch the things and she used to not go to kitchen. So I
Correct.
used to cook for all of us, right? And slowly when I was like 13, 14, then I understood why I was doing all those things. Then I realized, yeah, this is a one kind of help, I guess, in that situation.
Absolutely. So if young boys from the time they're in school, and I'm talking young boys at the age of 7, 8, 9, are made to understand the actual nature of what menstrual health or periods like we call it, or chums like we call it, they're taught what it actually is. It makes things much easier, much open to talk about. So it's not only talking about all these issues to a girl, it's about also talking about it to your boy.
Right.
So if you grow up and you can teach your son these problems, he's going to be a major support
Right.
to the women in his life later on, right? So it should start in school, not start when you enter college and when you have a girlfriend, or school and you have a girlfriend. No, it should start young at 7, 8. So, and it's extremely crucial because we need to educate and we need to create awareness for men to actually understand it. in our society, unfortunately, talking about women's health in front of men in certain societies or in certain religions is considered a taboo, is considered
Right.
wrong, is looked down upon. That mentality needs to change.
Right.
So they need to understand what is menstrual health. They need to understand what are fertility issues. They need to understand what are the hormonal changes that certain women go through, the upheavals that we go through. If they educate themselves about it, they will be able to support the women in their life, may it be their daughter, their mother, their sister, their partner,
Right.
anybody, right? So their support is extremely crucial for us women, even though under the hood of feminism, you say, oh, you don't need men. No, you do. You do need the men in your life to support you in these matters. So educating them, talking about it, having open conversations with each other is very, very important.
Yes, very nicely said. And I think all these small gestures will really help women to,
Absolutely. Absolutely. So, like we say that, having open conversations between partners is extremely important. Right? And when you say open conversations means educate yourselves about each other. The man about the woman, but the woman about the man too.
Right.
Because they also go through hormonal upheavals. Educate by reading books, educating by reading articles online which are, valid articles,
Right.
and understanding. Talking about contraception with each other, talking about fertility with each other. Men taking the stand that contraception is not only a woman's job.
Right.
If I wear a condom, I've done my job. No, that's not where it ends.
Right.
You need to have an open conversation and understand that there are points or there are times that you can undergo a vasectomy, which is the permanent solution,
Right.
depending on the situation, depending on the couple and everything. But you should be open to the idea of going through the procedure,
Right.
and not only make the women go through the procedure.
Right.
So that
And
is
I think that is one of the challenge that we have in
We
today's
do.
society, right?
We do.
Men generally don't want to go for such kind of surgery.
Surgical techniques, even though very frankly, the surgical technique for a man, that's a vasectomy, is a much, I wouldn't say simpler, that's a wrong way to put it, but an easier method than a woman undergoing a tubectomy.
Right.
Right.
And correct me if I'm wrong, it has lesser side effects as
Absolutely, absolutely, because it's a daycare surgery, right? Our government is actually initiating it since a very long time.
Right.
They have a lot of initiatives where they promote vasectomy and help men understand
Right.
it.
And also
So-
to control our population.
Yeah, that is the reason. But yes, but it's promoting it in a certain way, right? So having these open conversations and allowing these men to talk about contraception, talk about fertility, talk about how many children you want to have. If you're a couple,
Yeah, it
and
was
you're
not
look-
even discussed or
it's not
asked
discussed.
earlier.
It's just like कि मुझे इतने चाहिए और what you
मेरे
pregnant.
मम्मी ने बोला
हाँ,
है.
मेरे मम्मी ने बोला है या मेरी फैमिली ने बोला है मेरे बहन को इतने. No, maybe there are couples or there is a woman who doesn't want children.
Right.
So understand why does she feel that. It can change. Or a man who doesn't want children, it can change. But talk about it. Unless you talk, it's not going to happen.
Right.
And a lot of other small issues, right, which crop up. So having open-ended conversations is very important. Like, how are you feeling today?
Right.
I know it's, apparently the time when you are in your periods. So you don't need to say, कि अरे वो महीने का वो time है क्या?
Oh, right.
What is वो time? It has a name. So say the name. कि, are you menstruating? Are you in your periods? Are you in your chums? Are you feeling low because of that? Can I do anything to help you? Can I change your mood?
And I think most of the times they just need, you to be there.
Yes.
As I think Dr. Vrushali also said, like women always expect you just be there.
Just be there. Just ask. And there are times we are going to erupt and say, "Ki, don't want anything." But that's also an hormonal change. We are going through so many changes, right? We go through hormonal changes during the monthly cycle. We go through hormonal changes when we are pregnant. We go through hormonal changes when we attain menopause. Men go through it too, but women just go through it a little more and a little more frequent. Men supporting women when they are pregnant for antenatal, postnatal, going for visits, understanding that postnatal depression is a real thing.
Right.
It is not something that someone is doing just to garner attention.
No, my wife, she experienced it.
Exactly. So if it is something that women experience, the elder elders in the family, if you go to put it that way, say कि यार it's something everyone goes through. Normal है.
हाँ.
No, but it's in
It's
today's
like
day and
सर्दी
age.
खांसी हो गया, हो
हाँ,
जाएगा.
it's not normal है. Appreciate the fact that she's coming out and openly telling you that she's feeling ABC or XYZ, and help support it. If you feel you require medical advice, take the medical advice, whether it's a gynecologist, whether it's a psychologist, take the help and help her go through that
I'll
phase.
tell you my example. Like it took us almost 3.5 months to understand. It was a postpartum depression.
Correct.
Then, and that too, pediatrician suggested that she is going through this. Now you visit a psychologist and he can maybe help you out. So that way we executed the process.
But you actually at least picked it up. But if you keep things open, she will talk about it.
Right.
She will say, you know what, I'm feeling this way. It may be normal, but let the expert tell you whether it's normal or not.
Right.
Let her talk about it to you. So being there as a man or as a partner for your partner when she's going through these phases. Postnatal blues and depression is also seen after medical termination of pregnancy. So it's not only a pregnancy and giving birth or childbirth, but somebody who undergoes the medical termination is also going through or can go through these issues. So you have to be aware. So unless you're aware, you will never look for it.
Right. And I also have this one point where, because I observed personally, that the period just before you're about to deliver a baby, it's really crucial. I mean, that time, they are going through a lot of,
anxiety.
Right.
Correct. So she's anxious, she doesn't know what's happening, her body is changing, she doesn't know what kind of childbirth she's having, whether it's a normal, whether it's a cesarean. If it's a normal...
And there is also pressure from family that you should always have a normal
delivery.
Yeah.
So this is one thing that I always tell couples who come to me and who are under my care, and the immediate family. So I see to it that the couple and the immediate family gets counseled as a whole, that nobody is going to give you a medal कि अरे 12 घंटे लेबर के बाद normal delivery किया. No. Or nobody is going to say, wow, yaar, you went through so much labor. No. When your doctor, whoever is treating you, is telling you what your delivery plan should be, they kind of know, because that's what we have studied.
Right.
You're not the first and you're not going to be the last that we are going to deliver. Please put your points forward. Be comfortable to talk to your gynecologist or obstetrician, rather in this case, about what you want.
Okay.
I'm looking at this, I'm looking at a normal delivery, I'm looking at a cesarean, elective cesarean, and speak to your obstetrician so she or he can explain to you the pros, the cons, whether it's possible, whether not possible. And just before the whole thing, right, in your last third trimester, as a woman you go through a lot. Sometimes 80% of women go through, 20% still don't, and that's great. But 80% of women still go through a process where your body is changing. You're not the same that you were before you conceived.
Right.
You have to get a whole human out of your body. If it's normal, it's pushing a human out through your vagina, which is a process which is not easy to encompass. Or in a cesarean section, it's going to be a scar. Oh, is the scar going to stay? Am I going to still be able to wear crop tops? Is the scar going to become worse? Am I going to have these pregnancy stretch marks? Will they remain? Will they not? These are a lot of thoughts women go through, and it's not wrong to have them. Like people put them down by saying, "अरे खुद के बारे में क्यों सोच रही है?"
Right.
Scar है तो है. I agree, scar है तो है, but let her think about it. No, let her process it. Let her accept it. So, like cosmetic gynecology is a very important aspect today. But men need to understand it. Men cannot say, oh, don't do it. You are no one to tell somebody else what to do or what not to do with their body.
Right.
Everyone's body is their own sacred temple, and let them take the correct call or decision when it comes to that. So cosmetic gynecology is aesthetic, yes. Good, bad, there is no...
Can you just elaborate more about the cosmetic gynecology?
So cosmetic gynecology basically is aesthetic enhancement. One part of cosmetic gynecology rather is aesthetic enhancement of your intimate areas. Okay. Now the enhancement can be medical, the enhancement can be surgical. There are a lot of aspects which come under cosmetic gynecology, which help with vaginal transformations, labial transformations, clitoral transformations. There is a very, very common word used nowadays called mommy makeover.
Okay.
Okay, so which mommy makeover encompasses a lot of issues where women want to look again how they did
Right.
before they gave birth, right? And if she wants that, there's nothing wrong. And if you feel that your partner is thinking in a wrong manner, sit her down, put the pros and cons on the paper, talk about it, discuss about it. Just don't go out and say, "हाँ कर दो" या "नहीं नहीं मत करो."
अच्छा.
Get it out, let it be everything clear. So yeah, men play a very, very crucial role when it comes to women's health and women's thinking and decisions.
Right. I want to pick up one word which you said it correctly, like things need to be discussed between partner. I think that way
Absolutely.
only men can support a woman in her journey. And thank you so much for coming over.
Thank you, Tushar. It was great being here. Thank you.
Now, let's shift our focus to landscape of emotions and mental well-being. We have Anuradha Gauri with us, more than 13 years of experience in psychology. So, please tell us more about you.
So hi Tushar, it's lovely interacting with you here. So I'm a psychologist and I'm a psychotherapist.
Okay.
And then I've got, as you said, 13 years of experience. And I'm an expert in couple counseling. And I also deal with people who are having concerns of anxiety, depression, suicidal thoughts. So
Okay.
yeah, so I provide counseling for them. And I provide counseling online and offline, and I've got patients across the globe.
Nice. I mean, congratulations. And I'm really thankful for people like you who are actually, contributing to our society and people, right? And people are now mentally better, well. And they're aware of this fact कि उनको भी psychological assessment भी करने हैं, plus they have to go and visit.
Absolutely. Awareness जो है अभी ज़्यादा हुआ है. In a way, if we see post-COVID, during COVID also people had lot of issues. That is when acceptance आया कि हाँ
Right.
problem exist करता है.
Right.
So it is good that awareness has started, unfortunately in a very wrong space, but that has opened ways for people to understand that they need help.
Right.
And awareness is much better if we compare with earlier years that we were in.
Right. As we know, like a lot of women go through all this anxiety, depression, and suicidal thoughts and all those stuff. But very less out of those who are actually aware of it, or maybe they accept it. They try to approach a psychologist. So, what is your take on that?
So traditionally, Tushar, अगर देखा जाए, so earlier the family systems were different, right? So joint families में रहते थे, so support कहीं ना कहीं से आ जाता था. Slowly, now we are in a micro-nuclear families,
Right.
wherein only the mother, father, and the अभी तो single child पे भी आ गए हैं.
Right.
And if we see that women, whether they are working or they are not working, or even if they are homemakers, the purpose in their life is always children.
Right.
Right? बच्चे जब बड़े हो जाते हैं and suddenly they feel like, what next?
Right. Because बच्चे तो अपने रास्ते चले जाते हैं.
अपने रास्ते में चले जाते हैं and then suddenly they feel like अभी क्या करना है, right? What next? So that is where anxiety ho, depression ho, these things are quite prominent.
Right.
Right? And then अभी के ज़माने में good thing that we are seeing is the new generation is open,
Right.
suggesting therapy to their parents.
Right.
Or
I mean,
their mothers.
are you really seeing that change where kids are taking their parents to the therapy?
Absolutely, because अभी वो बोलते हैं कि Mama, you really need help.
Nice.
Okay, so let us go for therapy. But we do see some sort of stubbornness because they do not understand the benefits of therapy.
Right.
कि जाने से क्या होगा? See, when my husband is not understanding what I'm going through, बच्चे नहीं समझ रहे हैं, तो someone who is a stranger, how will that person help me? Which is a very genuine question.
Right.
But at that point of time, we do see that as a family, right? उनको immediately बिना push किए, when you are telling them that it is okay to speak about your emotions, what you're going through,
Right.
to a person who is non-judgmental. ठीक है, वो आपको judge नहीं करेंगे, and definitely a stranger, but they can understand your problem and sort it out for you.
Right.
So that thing will make them feel better. But even then, if the person is not, okay going for a therapy, then उनको थोड़ा self-help books देना, या फिर we call it mindfulness, that is allowing them to do some relaxation,
Right.
exercises, telling them that focus on whatever is, good things that are right at this point of time, gratitude, ये सारी चीज़ें when the kids speak about these things, so automatically थोड़ा उनका manage करना easy होता है, but at the same time introducing that a therapy will be better because then they're going to focus on you, your problem, and then you can cope up with things in a very healthy way.
Right. And as you said कि बहुत सारे women what they say is कि मेरा husband ही नहीं समझता है, right? And not in a funny way, but genuinely, like men and women, they both are different. Their functionality is different. So in this space, like how they can actually try to understand or maybe help their partners.
Right. So in Indian context, marriage is something that is still, in our society, it still exists.
Right.
Right. And marriage system works also,
Right.
wherein if we compare with Western countries, wo abhi, it is not that strong. But of late, we are seeing, because post-COVID, the increase in couple counseling cases is a bit, scary.
Right. Because बहुत ज़्यादा टाइम साथ में रहे हैं ना.
साथ रहते हैं, and at the same time, each one of them have their expectations, right? Women, obviously, they are expressive and they express what they want. But unfortunately, Indian men, right? उनको बताया जाता है कि you are not supposed to express because if you express yourself, you are not
Right.
considered to be a strong person, right? So that is where वहीं का वहीं they bottle up. And at the same time, because they don't know how to express, they cannot accept anything that the other person is accepting because they don't have an answer for it.
Right.
So at times, active listening works very well because जो बोल रहे हैं ना सिर्फ सुनो, even that reduces half of their pain. But men, they tend to feel like, acha, she's coming with a problem, I need to give a solution.
Yeah, I have read this beautiful book called Men Are From Mars and
Women Are From Venus.
So I sort of understood the functionality actually, and I think it is very difficult to understand because the mechanism is completely different, right?
Absolutely.
And in all this space still, like as even if we say कि मतलब हम लोग नहीं समझ पाएंगे औरतों को, but still, what do you think? Like just being there is okay. Active listening is also there. Like a lot of people are saying that okay, I'm listening, but also being a man, I'm telling you, sometimes you still feel okay. Why is she saying this at this point of time? So how can we deal with such situations?
So for men, obviously, उनका एक जगह पे जब बात कर रहे हैं, एक चीज़ की बात हो रही है, they stick to that.
Right.
They can focus only on that. But women generally, they can relate this to something else that has happened and then get that point as well.
Right.
But at that point of time, obviously, you cannot speak about these things, right? Active listening again is the first thing. Second thing, you can communicate to them that at that point of time, it is not helping their relationship, right? Because वो बोलने के लिए पहले इनको तो समझना है ना, the man should understand it is okay to say this.
Okay.
So there are two types of expressions that they generally give. Stonewalling, right? सिर्फ बिना कुछ एक्सप्रेशन दिए देखते रहते हैं.
हाँ, I have seen this in our Indian societies as well कि किचन में औरतें बड़बड़ करती रहती है and यहाँ पे कोई बैठ के, I mean,
So that's a general scenario because relationship तब वर्क नहीं करता है. So men should understand that first criticism doesn't work when a woman is sharing her problem.
Right.
Second thing is if she's sharing something about an incident in both of you, both the persons are involved, वहाँ पे defensiveness doesn't work.
Okay.
Because she's talking about the problem. उतना तक भी सोच सकते हैं ना. They can reduce the stress that is going on in their relationship. So in a way it contributes to the women because again a part of active listening is happening. Right? Defensiveness. Third thing is stonewalling. You cannot do that with anyone because once you're stonewalling, that itself shows that I do not acknowledge whatever you're saying. You are not that important.
The person will stop, sharing her maybe emotions or whatever she is going through.
That automatically stops because she feels she's not valued.
Right. And automatically, I think it will lead to depression as well because
Exactly.
As a partner, I think between men and women in a relationship, they will expect other person to understand more than anyone else.
It's always like that, right? No one would want to change themselves, but they would want the world to change for them. Right? So that definitely does not work. Whatever work has to change, work has to be done.
It has to start from within. So self-awareness is what we are talking about, right? So if the man is aware of the situation, right, and what is helping, what is not helping, at the same time we talk about women as well. So when two people are involved, it's not that one person only has to go through that journey.
It is a shared responsibility, I feel.
Absolutely a shared responsibility.
Now let's talk about the misconception.
Okay.
Right? A lot of men have misconceptions about women's, well-being, like mental well-being rather. So can you just tell us more about it?
So there are many misconceptions, Tushar. To start with, if women want anything, just keep crying about it, right? रोते बहुत है, ठीक है? जो भी करते हैं attention seeking के लिए कर रहे हैं, right? और they want to avoid a lot of work, इसके लिए ये लोग कर रहे हैं. And it can be like, एक problem को लेके कितने बार बात करेंगे.
Right.
And the fifth one might be like, मेरे problem को लेके हर जगह पे ये लोग बात करने लग जाते हैं.
Okay.
Right? So it is not like that. It's basically if the woman feels that she's heard at home, right? The husband can play a very important role because she doesn't have to be emotional to express herself in front of her husband.
Right.
But करना क्यों पड़ता है? क्योंकि वही है ना, साम दाम दंड भेद जैसा हो जाता है कि women initially she says that I'm feeling a bit uncomfortable about it. So whether it is your physical health, whether it is your mental health, gynec, anything related. There's one case which had come up last week. So the man was not very happy with the woman. Couple counseling के लिए आए थे, and the problem that the woman had or the wife had, that her skin was deteriorating very fast, and she was 52-year-old.
Okay.
So natural changes जो आ रहे थे, husband was not able to accept it.
Oh.
And she looked at a lot of videos at YouTube and all, and then she tried to educate her husband. Okay, and we are talking about people who are educated, not someone who is illiterate. But the husband is like, there are many other women who look good. Why are you becoming like this? So even that is something which she was not able to accept. And she's like, how do I explain this guy? And that had gone to an extent that they started having multiple fights. See, she ended up spending a lot of money on parlors, going to, do whatever it was possible just to look good. So the first thing is, when there is no understanding that what exactly is the purpose of the marriage and what exactly is the need of the marriage and what does she want or what is he looking at.
Which is other way also, like we are seeing a lot of beautiful women there and their men don't look that good. So they never complain. They also expect the change.
So it's the other way around also. There are women also who talk about this. The women say कि तुम्हारा पेट बाहर आ गया है. Look at other men who are looking so fit.
Right.
And thanks to social media, that everyone wants a Deepika Padukone or a Hrithik Roshan to be at home.
Right. VFX.
Yeah, VFX. They do not understand that the efforts that they are putting in are like hours together.
Right.
But
it is their profession.
It is their profession, and then they need to look good.
Right.
Okay. But at the same time, they also go through a lot of things which are not visible to us in the posts that they are posting.
Right.
But the basic understanding has to go, how is this relationship healthy, right? As a wife and husband, we as a unit, how healthy is our relationship?
Right.
And that starts with first expressing whatever you are feeling in a constructive way, rather than using you words.
Right.
तुमने ऐसे किया, तुम ऐसे क्यों बोलते हो, right?
Right.
So instead of that, telling that मुझे लगता है कि ये हुआ है. How do you think we can work on this?
Right.
Right? Again, rather than you, if we speak in the language that we together, how can we work on this?
Right.
That definitely will bring a drastic change and in a healthy change in the couple.
Right.
In interactions, and obviously बोलते हैं ना कि माँ बाप जो करते हैं बच्चे डेफिनेटली देखते हैं.
Right.
So उसकी छवि बच्चों में भी दिखाई देने लगती है. The boys will understand women in a better way.
Right.
And so that's what they say, if you're treating your daughter like a princess, first start treating your wife like a queen.
Right.
So that is very much what would I want to say.
And before we go, I have one last question.
Yes, please.
So we have this term called midlife crisis.
Uh-huh.
Right? So now let's talk about the age, right? So it can't happen at the same time for women and men, right? Maybe because of the the at what age they're marrying to each other can be.
So it is biological, Tushar, very frankly.
Okay.
So we are talking about premenopause, menopause and postmenopause, the 3 stages that women go through,
Okay.
right? And उसी में premenopause and menopause के बीच में ही midlife crisis होता है male का,
Okay.
right? So that is where, because at that age when we are looking at 40s, right? High responsibility, right? Financial pressure भी होता है, responsibility घर की भी होती है, family की responsibility होती है. So the man is also in lot of stress at that point of time.
Right.
And woman is definitely biologically she's going through this premenopause or menopause, which is also extremely emotional at one point of time. And they also have, in general, अगर statistics में देखा जाए, average age that their kid is young adult या फिर adolescent होते हैं. So it's like 3 atom bombs sitting in the house.
Right.
एक trigger होता है तो तीनों के blast होने के chances बहुत है. But it can start with wife and husband.
And I think that is the time where, I mean, which is my general observation, that is the time where when kids are in teenage, right? A lot of disagreements happens, a lot of conflicts happens in that particular phase. I think. What do you think? Like in this phase, like what exactly should be done? Like तीनों की तीनों जाना चाहिए therapy के लिए.
So therapy works in a way because first thing is, are you setting your expectations right with your teenager? You have to understand that अभी वो generation नहीं रहा जहाँ पे माँ बाप बोलते थे और बच्चों ने हाँ बोला है. Right? We have come way ahead of that conception wherein parents ने बोल दिया बच्चों को करना पड़ेगा. Now children want to explore different avenues, want to understand a lot of things, and be it that they have lot of information compared to what the parents are having.
Right.
Because again, thanks to social media, when constructively there are many kids who actually know a lot of things which the parents do not know.
Right.
And asking a lot of questions doesn't help. At that point of time, discussion is what need to happen. Right? For example, if they're disagreeing with their kid, instead of saying कि तुमको ऐसा नहीं करना चाहिए, instead of that, see, this is happening. So how do you think we can, improve this?
Right.
Because we are feeling a bit uncomfortable. So can you explain what exactly is happening?
Right.
So then the teenager is okay to explain because facts हर कोई बात करता है.
Right.
You cannot go with the emotional blackmail thing going on with teenagers.
And specifically for teenager, like girls, they are also going through a lot of emotional challenges. So I want you to highlight about that as well.
So girls go through a lot of emotional challenges, and in this generation definitely, because अभी impulsive behavior हो गया है.
Right.
And they want solution very fast. So instant gratification जो है ना, जो ये चाहिए तो ये चाहिए. And the major role is earlier जब discomfort या disagreement किसी से होता था ना, you had to wait till next day to communicate with each other that this is my problem, this has not worked.
Right.
And तब तक कभी कभी आधे से ज़्यादा problem हम लोग भूल भी जाते थे.
हैं.
But now because we have these mobiles, right?
Right.
Disagreements happen on mobile and then on chat, and then we disagree on chat, we fight on chat, and then we break up on chat.
Right.
Right? So we are not having, or the people in general are not having time to think what exactly are the behaviors that are not helping us.
Right.
Break लेने के लिए बोलो, then they'll say we are on break, but they don't understand their mind is not in break.
Right.
So obviously lot of stress, and ऊपर से biological changes जो होते हैं, right? So those things also contribute. So girls need to be aware of lot of things, that what exactly, self-awareness again. Be aware of what your surroundings are, whom you're talking to, what is the purpose of your life, or what are you expecting from life.
Right.
That will definitely give you few answers about how to navigate further.
Yeah. And to sum up with this, I think I can pick up one word, which is awareness rather. I think couple, they should be aware of each other's emotions, their challenges as well. And in terms of teenagers, and they should be also aware that there is a family there. They should also understand our parents are also going through a lot. So this is a common, I think, shared responsibility for a family.
For a family,
than
it's
a
not
couple.
only couple.
Yeah.
Absolutely. So that is when we can have healthy relationships in a family, because still India has a very strong marriage and family
Right,
system.
right. And thank you so much for all these insights. It was really nice. We thought of a lot of things. Yeah, thank you so much for coming.
Thank you so much for this opportunity, Tushar. Lovely interacting with you.
So you guys are expert in your own fields, right? So I want you to tell us few key takeaways or maybe few pointers that all of our viewers can remember in their journey with their partners. So, Dr. Mitsu.
So I would say two things. One is women, we all are beautiful. Exercise is one regime which can also work towards our anti-aging as we grow by our age. Definitely we are going to age, but exercise is one regime which can help you for anti-aging as well. So keep exercising and live life beautifully. Secondly, it's an old proverb which is said prevention is better than cure. So make sure you are checking on your vitamin levels like B12, D3, other vitamins which can hamper your physical activity or can give you a lot of other issues. But if they are taken care of, you are living your life very happily.
Thank you, Dr. Tushna.
I would say that all women, men, everyone should get their regular health checkups done. It's extremely important. Don't wait to grow old or a particular age to do it. It has to be done at a particular, start as you can. Speak to your obstetrician and gynecologist to know when you should start. Get regular pap smears done. Extremely important. Get regular sonomammos done, and it's important to live healthy. It's important to also work towards living healthy. So not only just diet and diet modifications and everything, but also checking your health parameters on a regular basis, and also please have open conversations at home with your partners, with your family. See to it that your children start having open conversations. It's going to take you way ahead.
Thank you so much, guys.
Thank you, Tushar.
Thank you.
Thank you so
Thank
much.
you.
Yeah, so for this segment, which is Swanky POV segment, I want your perspectives on this women's health with some key takeaways for us.
Okay, so my takeaways from a dermatologist perspective. Number one is before giving out any advice or taking any advice, look for where it is coming from. Is it coming from your chemist, from your neighboring auntie, from your beauty parlor didi, or from a certified dermatologist? Because that really decides how your skincare journey is going to be like. Okay, it's very important to know where your advice is coming from, because that is going to decide how your skincare journey is going to be. Yeah. Secondly, there is no alternative to sunscreen.
Okay.
Sunscreen is still the number one cream that can be applied on the face, whether you have acne, whether you have pigmentation, whether you have anti-aging, or you already have good skin and you just want to maintain it. Till date, there's no one who's going to beat sunscreen at its game. So you might as well buy your sunscreen and wear it. Okay. Lastly, there's been a lot of social media comments on commenting on people who do a lot of things for skincare regimen, and also commenting on people who don't do anything about their skincare regimen. I would say aging gracefully is a choice you make, and you decide what is your path. Make sure your dermatologist is your skincare partner along the way.
Okay, that's so interesting. Thanks, Dr. Vrushali.
So the three takeaways, Tushar, as a psychologist, I would say that, accept yourself with all your positives and negatives, ladies. And the second one, it is okay not to feel okay. So you just don't have to feel bad or guilty or regret whenever you're not feeling okay. Third thing, do not depend on social media for any of your solutions, because we are certified professionals who can definitely focus on the area and the problem that you are struggling with. As one size doesn't fit all the things that you see on social media, all the solutions, not necessarily help you.
Right. Thank you so much, Anuradha, and yeah, thanks for coming.
It's been a pleasure.
It's been a pleasure.